I jokingly, but not jokingly, sometimes say to people, I just obviously didn't interview well for other jobs. And so, I didn't get pulled in any place. But, if I go back when I finished my undergraduate and had a degree in human biology, which qualified me to do absolutely nothing, I worked as a unit secretary on a pediatric unit at Stanford University Hospital so that I could pay my rent. And then I worked with some undergraduate friends who were in business school to do a risk management study. And I got to know my first mentor, who at that time was the 32-year-old president of Stanford Hospital, if you can imagine, back in the day. And it was from that experience and being on the floor, but also doing this risk management study and learning about healthcare at the time, that I decided that I wanted to go into this field. And I went to graduate school. I came back to Connecticut to go to Yale and married my husband in 1978. And he's from the West Coast. Promised him we would stay here for 2 years in 1978. And that is one of hopefully not too many promises that I did not keep. But I've done a little bit of everything. I started as an administrative fellow. I've done staff work. I've done operations. I've done some new business deals. And I think the common thing is I've liked everything I've done. I never said no when somebody gave me a new opportunity, even if I had no idea how to structure an acquisition of an ambulatory surgery center and 2 radiology practices back in the 90s, which I had no idea how to do. And I lived for the opportunity of the time. I didn't say, I have to be here in a certain period of time and I want to be the CEO. I kind of lived for what the opportunities were. And I think in retrospect, I think that helped me both grow, but also enjoy the growth process.